From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is ICD-10 is just around the corner. Are you ready? There's been a lot of conversation around ICD-10 in recent months, and it looks like it really is going into full use October the 1st, 2015. That's less than 5 months away. Now, this is going to be one of the biggest transitions in U.S. healthcare to date. And Bon Secours wants you to know that the transition to ICD-10 will have a direct impact on you and our patients. So for us to be ready to continue to provide excellent patient care, our ICD-10 Project Managers have been working hard to help us get ready for the big change. But before we go there, let's talk about what moving from ICD-9 to ICD-10 means for the industry. First, we can expect to see improved patient care through more detailed and specific documentation. This documentation will support handoffs and enable data-rich decision-making. We can expect sustained revenues to better serve Bon Secours employees, providers, and patients. It will change how physicians, nurses, and other caregivers document their daily work. Additionally, for those who review documentation, such as clinical documentation staff and coders, there will be increased complexibility. So what can you do? Well, you can start by completing the required training assignments on HealthStream. You can get to HealthStream on Iris in the Quick Links section. Now, you should know that there are training deadlines, so please check that out right away. Also, if you have staff, encourage them to take the training on HealthStream. Next, you may need to make some changes in your workflow, but you will know more about how ICD-10 affects your workflow by getting to the training on HealthStream. You can also start brainstorming on how your area can support providers. Now, management will be asking for your suggestions in the near future, so give it some thought. This is a time of change, required and regulated change. So recognize and thank staff who have already put in long hours to prepare, but also include coding staff, clinical documentation staff, Connect Care staff, patient access staff, and billing staff. Now, this does affect everyone, but it is particularly impacting to them. Now, I'm going to encourage you to go to Iris for details. Iris has an ICD-10 key community, but definitely make your way to HealthStream through Iris's Quick Links and get the training. ICD-10 will be here full throttle October 1, 2015. It does affect everyone, so no one is alone here. But get the training as soon as you can and help Bon Secours get ready. In other news, Bon Secours St. Francis Health System is clearly an innovator, and this time it's carbon fiber. Did you know that Bon Secours St. Francis in Greenville, South Carolina is the first health system in South Carolina, and one of the first in the country for that matter, to use carbon fiber implants to treat skeletal fractures? Now, carbon fiber is used wherever high strength-to-weight ratio and rigidity are required. We know about carbon fiber in aerospace, automotive, and civil engineering, sporting goods, or any number of other consumer and technical applications. Well, now we are using that technology to help patients heal faster and stronger. According to Michael O'Boyle, MD, Medical Director of the St. Francis Osteoporotic Fracture Center, this new, innovative, and clinically relevant technology brings unique options and clear advantages to the field of orthopedic trauma and oncology. Most importantly, these options and advantages translate directly into benefits for the patients and their surgeons, resulting in fewer complications and faster healing. Carbon fiber implants to treat skeletal fractures. what's next. But it's all good help to those in need. Finally, you've got email. No, really, you've got email that needs to be read. Turn to the person next to you and ask, how are you? Many will say fine, but the rest will probably say busy. In fact, according to the American Psychology Association, most Americans say their stress levels are too high, and the main culprit is being too busy. It's also the reason why so many of us skip important details in our lives, like checking your email. But how can we make time to do all of this? And why is work email so important? Well, mainly, if you don't read your email regularly, you're missing out on some important stuff. Listen to this. At Bon Secours, we're really working hard to be good stewards of resources. So, we've stopped printing and mailing so many communications. But you still need that information. So now, some of the important details about your benefits, work events, webinars, and other training, as well as policy changes, are being sent to you by email. Some come from BSN Employee Communications, other messages come from the HSO, but all of them contain important information. So the message is, take at least 5 minutes a day to check your Bon Secours email. And please remember that missing an email is not an excuse for missing a benefit deadline or knowing about an important new policy. You've got email. Stay up to date and informed by reading it. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.